More people and younger people in both Ontario and Saskatchewan are eligible as of today to book an appointment for the Pfizer bivalent vaccine. Let's bring in Hilary Johnstone, who's looking at some of our COVID headlines for this morning. What's happening with boosters today, Hilary?
Good morning, Heather. Well, as of today in Ontario, people who are 12 years of age and older will be able to make an appointment. So that is going to be specifically for that new Pfizer-BioNTech bivalent vaccine, which targets some of those Omicron strains that we know are quite prevalent right now. People in Ontario who are younger, for example, so that 12 to 17, they're not eligible for Moderna. So that is very specifically for Pfizer. But everyone who's 18 years of age and older in Ontario has been able to go and get that Moderna bivalent vaccine for a little while now. But this is part of the province's plan, trying to really increase those levels of people who have been boosted heading into the fall and winter months. Of course, we know that there are some concerns that we could really see a resurgence, possibly a new wave of COVID-19 into those colder months as well. So that is the situation in Ontario as of today. Other provinces have already done this, have already opened up those appointments to people who in some cases are 12 years in age and older, in other cases are 18 years of age and older, depending on what supply a particular province might have. Because we know, for example, last week in British Columbia, that province started to receive its shipments from the federal government of that new Pfizer-BioNTech bivalent vaccine. Ontario will start to get its first shipments this week of that Pfizer-BioNTech bivalent vaccine. We know that it already had Moderna. So more and more provinces, Heather, definitely opening up those shots. New Brunswick is an example, another example of a province that just last week started to open it up. But we've been hearing sort of a common theme from top public health officials right across this province that they're not seeing the levels of people being boosted that they would like to see heading into those colder months. In particular here, they have really mentioned seniors, older adults who are not getting boosted at the levels that they would like to see.
That uptake is worrisome. You're quite right. So they've encouraged boosters because exactly what you've indicated, they're concerned about what the winter holds. What do they predict for us?
So not just COVID here that they're concerned about, but also influenza, the flu. They're worried that we could see quite a strong flu season, the likes of which we've not seen in a couple of winters now. If you take a look at Quebec as one example, as of Friday, so just a couple of days ago, there were 4,000 healthcare workers that were off work due to COVID-19 at the same time that you have that province hitting more than 2,000 COVID hospitalizations for the first time since August. So you have lots of patients going into the system, but not necessarily enough healthcare workers. And what we're hearing from some of those healthcare workers, including from one who works in Toronto, is that they're really quite concerned about some of these numbers. Here's a little bit of what we've heard.
We are managing wait times in our emergency departments that are beyond what we've ever seen. I've been in emergency medicine for almost 19 years now. And I have never seen the waits that our patients have to endure at all. And I think what's most concerning about it is that it doesn't feel like there's an end in sight.
And Heather, that warning has even prompted Ontario's top public health official to float this idea that mandatory masking may need to return this winter.
Hilary, thank you very much. Hilary Johnstone.